mission. I'm on a mission in a couple of ways. One, to change the way people think about dementia. If you look in big surveys, dementia is the disease that Americans fear most, more than cancer, more than AIDS. It's very scary, and I appreciate that. I have seen it up close. It's not that I don't know what dementia looks like, but I don't think it has to be that way. I think when we think of dementia, we often think of the final phase of somebody who can't move, who can't speak, but I don't know that that needs to be true even at the final phase, but it is not accurate for the vast majority of people with dementia who are in the earlier phases, who are trying to make change to get on the bus, who are, trying to figure out how to get around the world, and could do that if we had thought more about that earlier phase. We're so frightened of dementia that it's actually made our planning very poor, not just us individually, but actually our policy apparatus, our politics, what we fund, what we research. So our little teeny collective, I don't want to think about that, has amounted to like $zillion policy gaps. We don't have a way to pay for dementia care. We haven't thought about it. We haven't looked at housing and aging in place and how could you do that safely. We haven't looked at, could you make multi-generational options? Does that work for different sorts of people? And what choices? Not everybody needs the same thing. How could you have lots of an array of things, not just live at home by yourself or go to the nursing room? Those are your two choices. Like, neither one of those sounds very good for somebody with dementia. Shouldn't there be, 1,000, actually, in some of my slides, I have a little picture of Mao, and I say, let 1,000 flowers bloom. Yeah. So bringing back to our Chinese theme.